If you, yeah, please sit at the table, and we'll try to be efficient here in our questioning so that we can finish up in just a few minutes. So Alta has already asked to be on the list. Anybody else? Jeff. Okay, Alta, please.
This is just a comment, not a question, because Pat was extraordinarily diplomatic, because it was Bridget Hogan, our stem cell expert, and me that led the rump group that led to the deliberate creation of embryos part of that report. But the lesson that I think, maybe this question, would you agree with the lesson that I think I've learned, which is that Bridget and I and a few other people looked at our analysis of the moral status of the embryo and said, as a matter of logic, there was no way to distinguish research on a leftover embryo from one that's deliberately created, because the logic of the embryo status was entirely about embryonic developmental stages, which are not at all related to why the embryo came into being. So by logic, we decided that there ought to be fine. Whereas what we were not hearing from Pat was the political context that made that a significant difference for public sensibility or for political, political strategy, and that was a legitimate part of the discussion. So I guess the real question is, how do you know when you should or should not be incorporating these kinds of non-logic, non-analytical concerns into the advice that you're giving? Is it for the advisory committee to do that, or is it for the politicians to add that into what otherwise would be kind of a purist? I'm just trying to understand how these committees should function.
Well, I didn't start out, when I started out, I started thinking about these issues in the following way. When I'm dealing with something that is enormously controversial in the public, and you're being asked to reach a decision and you do an ethical analysis, you've done your ethical analysis, or you've done a ethical analysis. There is nothing, and now maybe I'm offending the ethicists, but there is nothing sacrosanct about an ethical analysis, because somebody can come right behind you and give another one. And I have had that experience. So when my rule, and this is a rule of thumb, that when you're developing an analysis, which is what you have to do, you do have to keep your eye on the fact that there are powerful groups of people out there, firmly committed groups of people who have a totally different analysis. And when you realize that, I just become pragmatic. That doesn't mean you don't go with what you have thought was best, but you should also think about making sure what ways would help maintain it. And the other argument we had was whether it was ethical to, was the request to have a review process an ethical question. I guess I could make it an ethical question if I started working on it hard enough. It's a practical question. What it does do is help to mitigate fears out there of those who don't always agree with you. Not to mention, you might get better science. One of the bad things about these debates is that we're not getting the oversight, not even IRB oversight, that would help to have better science, in my view.
Jeff Botkin.
Thank you for that presentation. I got a fairly concrete question. Would it be your assessment that the Dickey-Wicker Amendment precludes the pro-nuclear transfer method for MRT in the United States?
I have not done a legal analysis, and I have in my notes, which I must have been reading too fast, that it is a good question to consider whether it is precluded. Because if you take a look at the language of the Dickey-Wicker Amendment, which I had in this paper, it has to do with creation. I'll find the exact language for you. But it also involves destruction and manipulation. So I think, and I'm glad you asked me the question, that
but
somebody...
Dickey-Wicker should only apply to nuclear transfer, because the other are working on eggs, not on embryos. Right. And Dickey-Wicker specifically speaks only to embryos.
Nuclear transfer, right.
Yeah, but you start with 2 and you end up with 1.
Yeah.
So
But in one, you destroy it, and one you destroy
Right. Well,
in the
that's-
process of doing the research. That's why I say it is a good question about whether the amendment applies.
So I've got Jonathan Kimmelman and then Vamsi and Marni. Did you say? Okay. So let me read. Jonathan Kimmelman, who's on the phone from Berlin, has a question for you, Pat. He's one of the members of the committee. Can you please speak to the potential political reception of a U.S. regulatory agency, FDA in particular, approving a procedure or regulating a product that requires embryo destruction and conditioning a first-in-human trial on experiments that create and destroy embryos? Are there any precedents that you could point to?
I don't think so.
Yeah.
I think it's unprecedented for FDA to be asked this sort of question. I won't say never, but I don't remember any. And because it's a government regulatory agency, as distinct from something like NIH, that might be a problem.
Yeah. Vamsi and then Marni. And then I think we have to unfortunately adjourn this session.
Just a quick clarification on Dickey Wicker. That only refers to federal funding.
Yes.
So if there's a private sponsor for such a proposal, then that would be outside of the scope of Dickey Wicker.
That's how Gearhart and James Thompson
yeah.
were able to do their work. It was all private funding. And that is still the case if you're talking about generating a stem cell line.
Marni.
So that was exactly my question, half of it. So one, there's no laws prohibiting any of this, correct? This is all about use of federal funding for these activities. It's not illegal in the United States to do these activities. Is that correct?
That is correct.
Okay. And so the implications of our policy,
Yeah, what is the it you're referring to?
There's
embryos
no
stuff?
law that prevents, there's no law, that, as far as I know, that prevents anything except cloning. Some
Right.
states prohibit cloning, but I
States.
know of no federal statute that prohibits doing work on embryos.
got it. And then
Am I wrong?
No, it's just, there's a subtlety about when the FDA's regulatory
Yeah,
authority kicks
exactly.
in, at which
Oh.
point you need an IND, and to do it without the IND would be illegal, but I don't think that's what
That's
you were.
not what she
That's
asked.
not what you're asking.
I'm just what you guys are talking, the policy. So the other question is this idea of destroying embryos. In the process of just plain old in vitro fertilization, are not embryos destroyed?
They are often discarded.
Yeah.
Well, I mean, the
it's a
biggest thing
distinction, right?
is
that a distinction?
but there is no regulation in this country of in vitro fertilization, except if some states do.
But I'm just saying, when we're thinking about the policy implications of what we're doing, and we're trying to think about things specific to this procedure, if an embryo fails, or if an embryo is not used, an embryo's, however the term is, not used, right? And so that's not unique necessarily to this procedure. That exists anyway. I'm just saying from what everything you said was very informative, but we can't necessarily control policy, right? We could just say what's allowable and what's distinct about this, and that's not necessarily distinct from what exists in other assisted reproductive technologies now, which is the destruction of embryos.
We don't say the embryos were destroyed. They just went to college.
Dickey Wicker just precludes funding
Right.
for IVF research, federal funding for IVF
Right.
research. So it does have an effect, and it is true that embryos are destroyed.
We'll continue this discussion over the course of our work. Thank you all. Very helpful and very instructive.